Hi, everyone. Thanks for joining us today. We are going to be talking through a little bit of an update about COVID, the Delta variant. I'm joined today by Dr. Soufleris with the Mayor's COVID Task Force and Justin Furrow with Chambliss, Bonner, and Stoffel to walk us through some sort of best practices and what businesses can do to protect themselves in the current environment. So welcome to both of you.
Thanks for having me.
Absolutely. Thank you both for being here. So I'm going to start with you, Dr. Soufleris, and kind of go through sort of the brass tacks here a little bit. Can you sort of explain in broad terms what we're seeing with the Delta variant at this point and the spike in not just Tennessee, but across the country?
Sure. I think the spike is probably due to both behavioral changes and the Delta variant. As we look back, we had the last spike peaked early January, and subsequent to that, the cases fell. We get into early June, and between early June and early July, we had less than 20 cases a day in Hamilton County. Many of those days, less than 10. Vaccinations were kicking in. And although we aren't where we'd like to be vaccination-wise, the older population, the vulnerable population, did a pretty good job in getting vaccinated. CDC decided that masks were no longer needed for vaccinated people indoors. Unfortunately, unvaccinated people didn't want to wear masks anyway, so the masks went away. And I think, quite frankly, myself included, we were ready to get back with our lives, do things. We've been pent up for 18 months. And so I think we had this false sense that the pandemic, the worst of it was behind us. Then enter the Delta variant, started in India and ravaged the country. Lots of cases, lots of deaths. And then the variant made its way worldwide distribution, including Tennessee and the United States. And right now it's the leading variant within Tennessee, within Hamilton County, and within the states. And with that, we've seen really astronomical rise in cases.
What is it about the Delta variant in particular that makes it so much more dangerous or transmissible?
Yeah, it's basically, it is the thing that makes it different. It is much more contagious or much more transmissible. Virologists will tend to use, and I'm not going to get deep into science, but there's a term, the Rho value, and that's really it's a reproductive quotient for the virus. When we had the first original SARS-CoV-2 or COVID, that variable, the Rho, was 1 to 2, meaning that for every case someone's infected, they will pass it on to 1 to 2 people. We look at the Delta variant, that value is now 3 to 6. They've talked that it's as contagious as chickenpox. I think we backed off of that some, but when you're thinking that one person now can give it to 3 to 6 people, very contagious. There's questions as to whether it's more virulent, and I don't think there are unequivocal data to suggest that. We do see that there are younger patients. Part of that may be an epiphenomenon, the fact that older folks have been vaccinated, and the viral loads, the amount of virus tends to go up very quickly and gets people sick. So I think really it's transmissibility, and that's really what has made this variant as bad as it's been.
So you mentioned vaccines a couple of times now. I know there's been some talk about, with this variant in particular, it being even transmissible by people who are vaccinated. Is vaccination still your best defense against this?
the best defense against the Delta variant, against other variants, against coronavirus is vaccine. And you will hear me say that many times, okay? And we really have to look, vaccines really are a way out of this pandemic. If we try and say, oh, we're going to burn through this term of herd immunity, it's not going to work. We're going to have a lot of people dead, and we're not going to get through this. So vaccination is our really only way out of this pandemic. And we have to look at really what the expectations of the vaccines are as well. The vaccines are very effective at keeping you out of the hospital, but there will be some cases that don't. Keeping you out of an ICU and keeping you alive. Very effective at that, even the Delta variant. But with all the virus going around in the community, there's expectations that there will be, quote, breakthrough cases. And again, people will get the virus. They may have mild and really feel pretty bad as a viral infection. Hopefully, again, not get into those categories of hospital or ICU, but can be transmissible, can transmit the virus. And these were never felt to be a sterilizing where it prevents infection, so they're still very effective. And right now the pandemic is a pandemic of the unvaccinated. When we look at hospitalizations, look at deaths, that's the main group right now, unvaccinated people.
Sure. So when we talk about the Delta variant in particular, how do we know that it is the primary variant in Hamilton County? When you get tested, does it distinguish between Delta versus standard COVID?
No, that's a good question. And what they do is they sample and they do the viral genome. That is specialized testing. And we are only sampling here and there, but with sampling and statistics, you can see that the Delta variant has become predominant, again, in Hamilton County and across the nation.
Sure. So I know Delta is our biggest concern right now, but it's hardly the only variant out there. Are there others that we're keeping an eye on at the moment?
Yeah, I mean, we've seen Alpha come and go. That was the UK variant. We've, again, Delta is our primary. There's another one down the road, Lambda, that came out of Peru. But we haven't seen it breaking out of the area in South America. So we're really not concerned. But I mean, I think we really have to look at what is the deal with these variants? What are variants and what's going on? And I think just a quickie, when anyone gets infected with viruses, you're infected with trillions of viral particles. And as these viruses are trying to replicate, the genetic material, the RNA, is read and duplicated. And there are errors that are made. And when you have that many viral particles, you could have errors or mutations. Some of those are terminal, meaning they're fatal to the virus, and obviously those die out. You have some that may change mildly, and because we have so much of the Delta variant now, if there's no real advantage to this mutant, it will sort of fall by the wayside. And that's sort of what happened with Delta. It was the Alpha variant that was sort of making its way worldwide, and then you had this mutation. It allowed Delta to become more transmissible, and all of a sudden, where the old virus, one person would infect one or two, Delta, one person's infecting 3 to 6, all of a sudden it becomes the predominant strain. And again, here's where vaccines, if you get rid of susceptible individuals and get them out, become non-susceptible by vaccine, that will prevent more people from getting highly infected and more of these variants occurring. So again, another push, uh,
Sure.
vaccination.
Um, and that sort of brings us around to where we ultimately wanted to get with this, which is precautions. This is going to be sort of a two-parter. I'll start with you, just from a health and safety perspective. What are we recommending that businesses do at this point to protect themselves, their employees, their customers? What sort of
Yes.
precautions can and should they be taking?
Yeah, and I think really all businesses should encourage their employees to get vaccinated. So say that's important. And I think we also have to think now mitigation strategies. We've heard that before with various mandates. We don't have any in place right now, or I'll let Justin talk more about that. But I think the mitigation strategies really almost depend on density or exposure time, is what I'd say. And just a few examples, if you have a small business, a little dress shop where you don't have a lot of customers in and out, the space is fairly large, people could be spaced out. In a situation like that, you might have your employees wearing masks, and when they're helping the patron or the customer, they can wear the mask, and I don't think there's going to be a major exposure time. You may have a barber or a hair salon. Someone's going to be in a chair for 20 minutes to a half hour to a couple hours, depending on what's being done. Close contact, by the CDC, that's 6 feet. I think most barbers, it's 1 foot. And so in that particular situation, certainly the barber or the hairstylist should be wearing a mask, but I think you could also ask your patrons to do that. And I know when I was talking to Mayor Coppinger, he even mentioned that a barber had called and said, "Man, I wish you had the mask mandate." And that's when Mayor Coppinger says, "Well, for your business, it makes sense that you have your customers wear masks, and you should post that. And if they really don't want to, they may have to go somewhere else. You clearly don't care as much about your health." So, and then you sort of get into smaller or mid-sized shops with high density. It's important for the clerks in that particular store to be wearing masks. I would like I guess part of it is, what do I do personally? I had a little period of there where I didn't wear masks. I'm back to wearing masks when I go in for the safety of everybody. I'm fully vaccinated, but I could pick it up and pass it on, and that's part of community. But I think in those particular situations, it's masks encourage. You would hope that patrons would sort of join in there.
Sure.
Our goal has always been on the mayor's task force for businesses to thrive. We know that outdoor is safer than indoor. When we're talking restaurants, I can't imagine what they've gone through over time between takeout and all, but I think we go back to last summer when we had the advice of try and do as much as you can outdoors. Real important to do that. And in fact, Chattanooga um, had their advertisement, come outdoor activities, do a lot outdoors. And I think it helped the economy. And so I think we have to be sort of creative in that respect. When you get into larger stores, it's tough. We've now gone where you're not wearing masks, and you go into a big department store. I think they would have to set their policies. In crowded stores, I think it makes sense to wear masks. And again, I'm vaccinated. I'm going to wear a mask. There's other people who aren't vaccinated, and hell no, they're not going to wear a mask. And I think that's the tough part. But I think businesses, at least smaller businesses, can try and tailor with what I've said. And again, if if the workers are vaccinated, it's helpful with all those situations. They have a mask and vaccination. It's safer for them. So that's another way to encourage vaccines as well.
Okay. So Justin, let's talk about what they can do. I think a good place to start would be, there's been a lot of crosstalk over the past several months about mandates versus requirements versus suggestions. What guidance, what mandates, if any, are in place right now, as of today?
Yeah, so with respect to Tennessee employers, not much. If you look from the federal OSHA standpoint, which Tennessee typically follows, Tennessee has its own Occupational Safety and Health Administration, but it follows basically federal OSHA. With the exception of healthcare employers, which have an emergency temporary standard that applies to them, OSHA has released guidance and recommendations, not mandates, not requirements, not laws, but guidances and recommendations. Those which were updated 5 days ago now largely track the CDC's guidance and recommendations. Again, not requirements, but guidance and recommendations. There's no local mask mandate. There have been recommendations by both OSHA and CDC to have fully vaccinated and unvaccinated employees wear masks. That was an about face from the CDC's May announcement, I believe. But for Tennessee-based companies that are not in the healthcare sector, there isn't much by way of mandates right now. There's just a lot of guidance and recommendation, which, as you mentioned, creates a lot of crosstalk and confusion about whether we're supposed to do something or whether we should do something. And, I think as Dr. Soufleris mentioned, it really, when you're talking about mitigation, it really results in, or should result in, an evaluation of your workplace and evaluation of your workforce to determine what strategy works best for you, because there is, I think, as we're seeing, no one size fits all solution.
Okay. Given that, I'm just going to sort of step through here the different pieces, I guess. If I'm a small business owner and I want to require my employees to wear masks, can I do that?
Yes. Separate and apart from, and I think the answer is probably going to be the same with all of your questions, right? If I'm looking ahead, you're going to ask me about masks and you're going to ask me about social distancing. And we're probably going to step our way up to vaccines. And so, not to take your thunder away, Jeremy, but to head you
no,
off,
please go.
Yeah, head you off the past a little bit. I mean, the answer to all those is going to be yes. In the state of Tennessee, particularly, and even at the federal level, employers have a wide degree of latitude with respect to imposing requirements on their workforce. So I, as an employer, can require masks. I can require social distancing. I can require vaccines, subject all, of course, to limitations under the Americans with Disabilities Act for individuals that have a disability and may need a reasonable accommodation, subject to religious objection under Title VII of the Civil Rights Act of 1964. Individuals who have sincerely held religious beliefs can ask for a reasonable accommodation. And then there are certain pregnancy considerations that need to be accounted for under the Pregnancy Discrimination Act. As long as I build in a mechanism to deal with those, I can make all the requirements that I want, and I can subject, assuming there's no medical issue or no religious issue, or there's no accommodation that can be had, I can subject those people to everything up to and including termination if they don't adhere to the mandate. So just like you can require your workforce to wear a uniform, you can require them to get vaccinated. And that's a tough pill to swallow for some employees that are hesitant, that are resistant, that are concerned about the vaccine. And I'm not going to comment on whether that's a valid concern or whether that is. I mean, Dr. Soufleris can maybe comment on that if he chooses, but there are some people realistically who do have concerns about the vaccine. And unfortunately, in the business environment, employers have a wide degree of latitude, and they don't have to countenance, they don't have to give credit to or credence to those just general objections that are not grounded in a religious or a disability related objection.
Okay. What about customers? If I ask a customer to leave my store because they refuse to put a mask on, or can they turn around and sue me?
Great question, and that's it. I'll give you a lawyer answer. Anybody can sue anybody for anything, right? Doesn't necessarily
Sure.
mean it's a valid lawsuit. It's what keeps us lawyers in business. Doesn't mean it's a valid lawsuit, but anybody can sue anyone for anything. But to give you a technical answer, so you've probably walked into a number of businesses and seen no shoes, no shirt, no service. So if I try to go in shirtless, not in addition to making everyone shudder, I won't be allowed into that facility, right? It's the same with masks. There is a component of the Americans with Disabilities Act, I think it's Title III of the ADA, which relates to public accommodations. And so you have to provide accommodations to individuals with disabilities. There's been some commentary and guidance, a lot of people talking about whether that applies to mask requirements. I think it probably does. You see in a lot of the mask mandates, and even the one locally, we have the carve out for medical contraindications, which I think is really a Title III ADA disability consideration. So if I'm someone who says I have severe COPD and therefore I can't wear a mask, you would have to accommodate me if you could. That said, what it really does from a business perspective, I was reading an article the other day, how it really puts like restaurant workers and frontline clerks and cashiers on the enforcement mechanism of either a mask mandate or for the cities, and not in Tennessee, but for the cities that have required vaccine passports of the vaccine mandate. It really puts them in an untenable position, because whereas it's may not be a legal requirement, it may be something the business has chosen to do. And we have a lot of rights as business owners and private property owners or lessors. But it puts these people on the front lines of having to deal with irate customers. We've all seen the articles about people objecting to masks and fistfights and violence and all that kind of stuff. And so, but the short answer is yes, I can require that of my customers with maybe a little asterisk.
Okay. So I don't want to get too doom and gloom here, but I do want to sort of lay out for folks, if things continue on the trajectory that they are currently on, Dr. Soufleris, what do things start to look like for us as the weather cools off and people start to move indoors?
It may be disastrous. When we look and we say, what is the danger of this trend continuing? Well, we start out with, since I'm in healthcare, you will outstrip healthcare capacity. We already see in Middle Tennessee, there's no ICU beds. Vanderbilt has been closed down for a while. Surrounding little ERs and hospitals that usually feed into Vanderbilt now don't have anywhere to take care of these patients. And it results in, and even here, we're over 200 patients, COVID patients, within the 3 major hospitals or 4 major hospitals in town. And it's already having an effect. You see delays in non-COVID patients. One of my patients had an infection, came into the hospital, went to the ER, took 2 hours to get to triage, and they told him that to get into a room, it'd be another, by morning. This was 10 at night. He went back home, later on went to a different ER from a different hospital and one of the satellite ERs and got into the hospital, but he was not doing as well. Care definitely suffers. You make these units have to pop up here and there to take care of COVID patients. In Middle Tennessee, they got tents and parking lots to care for patients. Staffing issues we talked about earlier, the mental health of nurses and all. So really, the system can be overwhelmed. What you talk about too is with high prevalence of the virus, getting indoors, you're going to have more cases, exponential growth, and just by the nature of the virus, a percentage of people are going to get very sick, requiring hospitalization. A percentage of those will end up in the ICU, and a percentage will end up dead. So if you have large increases in numbers, unfortunately, deaths increase as well. And And not to mention that some of these ICU cases, when you come out, you are disabled long-term as well. And we look to even circling back to the business community, we enjoyed a month or so thinking that, again, the pandemic was behind us. And now people have to rethink. Are you going to go back out and do your shopping? Indoor dining, people want to do that. Are we going to be back to takeout? Travel, which looked to take off, I think people have to think about that again. So, for the economy to reach its potential, the virus has to be controlled. And right now, we are not doing a very good job of that. And I get back to our best control measure right now, because we really don't have any medications to treat. We have some that will help people, but there are no medications to treat. Vaccines, I guess the one little thing, if someone gets sick early and they high risk, monoclonal antibodies, you might have heard about those, can protect people from getting very sick. But that's the one medication that we really do have to treat. So it's I'm pretty nervous about things. It sounds pretty dire. And there's still a lot. I'll shut up in a minute. There's still a lot that we don't understand. India still had a lot of people that were susceptible. Why did all of a sudden the cases start dropping? I throw that out rhetorically. It just lets us know that we may think we're getting all the answers. The more we learn, the more we know we don't know. As with any specialty or any particular
area. Okay. And I'll say real quick again, if anyone who is watching has a question, feel free to put it in the Q&A, and I will ask it on your behalf. But first, I'm going to be real unfair and ask Justin to predict the future. Given all of that, do we foresee what is the potential for new restrictions going into place or going backwards towards things like, the lockdown and the earlier days of the pandemic? Do we foresee any of that on the horizon potentially?
That's a great question. I think it really depends on where you live. I would be very surprised, and let's just be honest, see the typical breakdown, right? I think you see typically your Republican states and your Republican municipalities that are resistant to mandates and lockdowns, and those that are controlled by Democrat governors, Democrat mayors are more susceptible to lockdowns and mandates. That's just kind of the way it's broken out over the course of this pandemic, right, wrong, or indifferent. I think if you look at the legislation that we're seeing filed in some of these states, let's just focus on Tennessee, I would be very surprised to see another mandate or lockdown go into place. I think there would have to be something extraordinarily dire nationwide and in Tennessee for that to happen. You've already seen the governor's executive order that was issued this week relating to mask mandates in schools and the ability of parents to opt out. You've seen the leaders of both the Tennessee House and Senate try to call for a special session to address COVID precautionary measures and what they consider to be the overreaction to those. And so from a Tennessee perspective, I would be very surprised to see governmental mandates and lockdowns that go into effect. I think what that does then is it puts the onus on the business community to do what's best to protect their businesses. And what you start seeing a lot of, and you're asking me to predict the future, and sure, it's unfair. I feel like I've kind of predicted it before, not to take any credit for it. It was a pretty easy prediction, but when I first started talking on these webinars about vaccines and vaccine mandates, we weren't seeing a lot of vaccine mandates from employers because you had a lot of people that were getting the vaccine. So when they first came out, you had a bunch of people rushing out to get the vaccine. And so that momentum was going. What I thought about at that time is as we start to see the headwinds, the resistance, as we start to plateau on our percentage of vaccination, employers would be reconsidering whether they wanted to encourage or require vaccines. I can tell you personally, I'm seeing more of that now. If you look at some of the articles that are out and just some of my own, I'm an employment lawyer and I advise companies on this stuff every day. And so just some of my own interactions with individuals, I'm getting more calls about, hey, can we require the vaccine? And if so, what do we have to consider? So I think you'll start seeing more businesses who are trying to, I mean, let's face it, we've got a shortage of workers locally right now. We have supply chain disruptions, right? This is separate and apart from COVID. Those two things exist and they're making it more difficult. If you think about your manufacturing employees, I mean, look at VW, they can't get chips in and they can't get workers to make cars. What happens when you, on top of that, have to shut down a production line because of a COVID outbreak? So I think the onus is going to be on the business community to figure out what's best for their business to keep the doors open. Is that going to be a vaccine mandate? Is it going to be a mask mandate? Is it going to be something else? I think it's going to depend on each individual circumstance, but I think that's where you're going to see requirements. And it puts employees, as I said earlier, at an interesting crossroads, particularly those that don't want to get vaccinated, because you hear all too often that I shouldn't be forced to put this in my body, and I shouldn't be forced to do this, forced to do that. And those people are well-intentioned, and they're certainly able to have that that opinion. And I'm not passing judgment on whether it's right or wrong. I'm not a doctor. I don't know. What I do know is from an employer's perspective, I also have the right to say, this is what you have to do. And separate and apart from a legal reason, a disability or a religious reason, I can ban you from my workplace if you're unwilling to get that. So you, just like you have the right to not get a vaccine, I have the right to not employ you if you don't have a vaccine. So it's really going to create some employee relations issues. I think you have some companies that are perhaps maybe desirous of a vaccine mandate, but resistant to it because they don't want to run people off. They don't want to exacerbate their staffing shortage. But, to circle back to your original question, mandates and lockdowns, I don't necessarily foresee. I think the government in Tennessee would be hard pressed to do that. I think the business community is going to have to figure out what is best for them to keep their doors open and keep the manufacturing lines running and keep the customers coming in.
So along those same lines, then, as the business community has to figure out how to navigate this on their own, really, what about financial aid? Has what's out there dried up? Do you see any more coming down the pike at all?
Geez, I mean, I think we've spent $6 trillion-ish in the last 18 months. We had a $2 million CARES Act. We had the one that was passed at the end of the year. We had the American Rescue Plan. We have the infrastructure, which is $1 trillion, and we have a proposed budget of $3.5 trillion. Is there going to be money in there? I'm sure it's buried in there somewhere. If you think about the programs that everyone knows about, the EIDL loans and the PPP loans, those have dried up. I don't know that they'll come back around. You had a second round of PPP for the hardest hit businesses. And so I think, at least locally, you have businesses that were hit hard that may have gone out of business. Those that stayed open have kind of emerged, and they're in that precarious position of wanting to continue that momentum. Whether there will be another stimulus, I don't necessarily foresee it. I think there would have to be, again, something dire happen for probably the federal government to come and put another, several billion or $1 trillion in at this. And I hope we don't end up there, because if we end up there, I think we got bigger problems.
Sure. Okay. Well, I think I would wrap this up then with asking each of you sort of an individual question. Dr. Soufleris, what would you say to someone who hasn't gotten vaccinated yet, might be hesitant about it? What would you say to them at this point?
Yeah, these are difficult, and I think as Justin said, there's a lot of reasons why people don't want to get vaccinated. Number one has been really social media and misinformation. I wish we could hold these people accountable when all is said and done for the deaths they've caused. And it also depends early up front, or not early, but up front, sort of where the people stand. If you have a militant anti-vaxxer, as I call them, you're not ever going to reach them. My sister-in-law included. But, I will approach anybody and talk to them about it. And usually I try and provide information. When I approach somebody, I say, have you had the opportunity? And a lot of times this is nurses who care for COVID patients, yet have not gotten vaccinated. That tells you how people who have been in the front lines, there's a lot of emotional energy behind this as well. So if you had the opportunity, and usually I approach them saying that I'm worried with this Delta variant. I'd be remiss in not talking to you because I'm concerned that you may get sick from COVID, and I feel bad that I never approached you about that, even though I know you may be against it. Ask, do you have questions or concerns? I let people know up front, carry it on the back of my badge, I'm vaccinated. That's my little vaccination sticker. And it's interesting that 95% of physicians nationwide are vaccinated. Doesn't go for a lot of other healthcare workers. These vaccines are, I talk to them, they're safe, they're scrutinized. In fact, some of the most scrutinized, you can pick out problems with the vaccine on a level of Guillain-Barré, ascendant paralysis. It usually occurs in 1 per million. They see it occurring in 2 to 3 per million. Is that? So it's to that degree that we're able to scrutinize these vaccines. And they're effective, keeping people out of the hospital, etc. I think the other way that we need to look at this, it's not vaccines and potential side effects, it's vaccines or getting COVID, because that's what's going to happen here over these next couple of years. And this is going to be around it's going to become endemic and with us for the future. But you are either going to get vaccinated or get COVID, or maybe both, And the question, do you want it in a controlled environment with a vaccine that's safe and will prevent you from getting sick? Or you want to go with, as I call it, the crapshoot of getting COVID, where you could have anywhere from asymptomatic disease to ICU, need for ICU. We don't really even know about disability there. I mentioned it, but some people who are very sick come out of the units quite disabled. Others with long COVID, we're only beginning to see that. And that's our next public health crisis, when about 1/3 of adults develop symptoms that are long-term. So that's usually the approach. There's a lot of emotion with this, obviously, but I try and approach, and I now go after sort of individual nurses that I've seen that tends to be a group that I'm around that may not have got vaccine, and I pull them aside and we talk, and I've had some success. I've had others that's, I'm thinking about it. They'll be thinking about it till they get COVID. I'll leave it at that.
Okay. And then Justin, for you, what would you say to a business who is looking at all of this and considering, what they need to do in the immediate short term, as far as protecting themselves and everyone else around them?
Well, the first thing, Jeremy, I would say is call them. But just kidding. In all sincerity, there's a lot out there to manage. And ultimately, for each business, as I mentioned, there's no one size fits all solution. And so that business owner, that manager, that CEO, that HR director, safety personnel, whoever it may be, probably a committee, is going to have to distill a bunch of information and ultimately evaluate their own workplace, their work environment, and their workforce, and determine what's best for them. The CDC guidance and OSHA guidance is a good starting point, but again, it's not mandatory. And there are a bunch of carve outs and wiggle points and ways and spots where you can say that doesn't work for us but here's what we're going to do. And ultimately, each business owner is going to want to keep the lights on, the doors open, the people coming in or working remotely, whatever the environment is, and the product or service going out the door. And so it's just a distillation of a bunch of information and an analysis of how this pandemic impacts them, and how they can keep running, whether that be determining a percentage of population vaccinated, whether that's additional mitigation measures, whether that's a mandatory vaccine or mandatory mask, whether that's mandatory work from home. It will be different, and I could get 10 calls in the next hour and the answer would be different probably for all 10 people that called. And so really it's evaluate the information, evaluate your population, your workforce, and determine what's best for you and how you believe with, reasonable good faith based on your best judgment, you believe you can keep your people safe.
Okay. Well, hopefully this has been some useful information for our members. Thank you both for being here. Justin, an old pro at this point, and Dr. Soufleris, I think this is your second one with us. Appreciate the work that both of you have done trying to help people through all of this. And I hope they get something valuable out of this. So thank you.
Jeremy, thank you. And thank you for the chamber for organizing this. I think it's a great benefit to the members. And I'm not saying that just because Dr. Soufleris and I are the speakers, but thank you and thank the chamber for all you guys are doing.
Thank you very much. Thank you very much. Appreciate it.